Good afternoon, everyone. Thanks for joining me today. So, in this webinar, we're going to talk menstrual health at work. I'm Ganesha, and I am the Workplace Menstrual Wellbeing Manager here at Endometriosis UK. Just in a nutshell, my role in the organisation currently is I'm running a project, and the project focuses on menstrual health conditions. Obviously, endometriosis is one of the conditions that we do highlight, but there's 5 other conditions that the project also looks into as well. And my main role and responsibility is kind of ensuring the information is out there, ensuring that managers, HR teams, employers in general are supported to support their staff with menstrual health conditions, and allow women and those with menstrual health conditions to thrive at work. So just going to do a quick overview of what we're going to talk about in the hour that we have for the webinar. So I am going to go through 5 menstrual health conditions. Endometriosis will not be one of them, just because we are going to do a kind of silo presentation on that, where it'll be endometriosis at work. That will happen in March during Endometriosis Awareness Month. So do tap into that. But obviously, if you do have any questions around endo at work, do pop it into the Q&A chat, and I can answer that all at the end. So I will go through 5 menstrual health conditions. I'll talk a little bit about menstrual health at work, the impact at work, and then the last 10 to 15 minutes, I will also talk about best practice, example suggestions, and way in which colleagues support their colleagues as well. So, menstrual health conditions. So these are the conditions I'll be just quickly running through today. So I'll start off with polycystic ovary syndrome, premenstrual dysphoric disorder, adenomyosis, fibroids, and heavy menstrual bleeding. So we're going to start with polycystic ovary syndrome, also known as PCOS. So PCOS is a chronic lifelong condition affecting 1 in every 8 women in the UK. It is a common condition that affects how a woman's ovaries work. Common symptoms of PCOS include irregular periods or a complete lack of periods, irregular ovulation or no ovulation at all, and this can lead to subfertility, unwanted facial or body hair, oily skin, acne, thinning hair or complete hair loss from the scalp, and weight problems. So this could be being overweight, you could experience rapid weight gain, but also difficulty losing weight as well. PCO affects women in different ways, so not everyone will have all these symptoms. Some may only have mild symptoms, while others may have a wider range of more severe symptoms. And just want to highlight the symptoms such as unwanted facial or body hair, the oily skin, acne, etc., the thinning of hair, and the weight problems. You may sit here and think, how does that impact someone at work? It does. It can knock their confidence, their mental capacity and their mental well-being. It can have an impact on, and therefore it will also have an impact on their work. For example, if they have to do a lot of frontline delivery, or if they have to do a lot of talks in front of people or communicate a lot of their work around people and be kind of in the forefront, they may not feel comfortable. They might lack a bit of confidence if they feel that they have severe acne because of their PCOS, or if they have oily skin, or if they losing their hair, they may not feel comfortable in their body. So it's just also being really mindful around those symptoms as well, because you might think that it's not directly linked to the womb, because I think people think about menstrual health conditions and it being kind of part of the reproductive system, but there are other things that do amplify the conditions. There are other symptoms as well that you must keep in mind as employers, and I think that's really important to highlight. The diagnosis of PCOS is done via a blood test, which can be arranged by your GP. And some individuals may also need follow-up appointments as well. So be really mindful of allowing your staff to go to these doctor's appointments. And if you are here today as an employee, don't be afraid to ask for your doctor's appointments, or just let your employers know that, you'll be needing to step away from the screen, or, this is something really important. You're trying to be diagnosed for a condition and you must attend this doctor's appointment. I will highlight the importance of appointments, and navigating your work around that later on as well. The treatment of PCOS is tailored to each individual. So as the symptoms may differ, the treatment will also differ. And they may include medication to regulate periods and improve ovulation. And I just want to highlight, so some of the work that we do with or around PCOS, we work very closely with a charity called Verity. So if you are here today and you want further information on PCOS, or you want, resources to take away, if you go onto the Verity's website, there are tons of information, there's tons of resources that you can access and you can take away from that as well. I will also, again, there's a slide at the end that covers all the resources, so I will reiterate that again as well. Up next, I'm going to talk a little bit about premenstrual dysphoric disorder, also known as PMDD. So premenstrual dysphoric disorder is a cyclical hormone-based mood disorder. Symptoms arise during the premenstrual luteal phase of the menstrual cycle and last until around the time the period starts each month. This will happen every menstrual cycle when ovulation occurs. It is commonly still misdiagnosed as bipolar disorder or written off as just a bad PMS. So some of the kind of, symptoms someone with PMDD will experience are mood or emotional changes, and this can be mood swings, feeling suddenly sad or tearful, or increased sensitivity to rejection. They may also experience irritability, anger, or increased interpersonal conflict. They'll experience depressed moods, feelings of hopelessness, feeling worthless or guilty, and they will also probably experience anxiety, tension, or feelings of being keyed up or on edge. A diagnosis of PMDD is a little bit trickier, but you must, it requires a presence of at least 5 of the symptoms I've just mentioned, because these are the core emotional symptoms associated with PMDD. The only way to currently be diagnosed with PMDD is tracking your symptoms on a daily basis for at least 2 menstrual cycles. And then from that, once you've tracked it, make a note of them, make a note of how you're feeling, when you're feeling it, etc. And you can do this through, there's loads of apps, there's loads of period apps that you can track, or, notepad and pen. As long as you're tracking it, you can go to your GP, you can showcase, the different symptoms that you've experienced in the last 2 period cycles. And I just want to also, again, here highlight that we do a lot of work with the International Association for Premenstrual Dysphoric Disorder. And if you go onto their website, again, loads of resources, but they also have a kind of PMDD checker. So you can answer a few questions, and then at the end of it, it can it won't obviously give you a diagnosis, but it will start to give you a kind of pathway to a diagnosis. So definitely check that out if you haven't done so. And if you do think that, you feel you're here today that you might have symptoms of PMDD, I would highly recommend tapping into the International Association for Premenstrual Dysphoric Disorders website. Again, we'll link it in at the end. So going to move on from PMDD to the next side, which is adenomyosis. Now, adenomyosis occurs when the tissue that normally lines the uterus grows into the muscular wall of the uterus. Now, on the right-hand side, you can see 3 different images. So you have focal, you have adenomyoma, and you have diffuse. So all within the lining of the uterus, but in terms of the adenomyosis, they're kind of different. So the focal is quite, again, very explanatory there. It's focal, it's in one place. You then have an adenomyoma, it's a lot larger. It kind of obviously, can you see it's kind of coming out of the muscular wall as well. And then on the last image, you have diffuse. So you have you have adenomyosis in different sections and in different areas, but still within the muscular wall of the uterus. Symptoms of adenomyosis are painful menstrual cramps, heavy menstrual bleeding, abnormal menstruation, pelvic pain, painful intercourse, an enlarged uterus, bloating, and pain related to bowel movement. I have read that list out, and some of you might be here today thinking, there's very common symptoms in terms of it overlaps with stuff like endometriosis or fibroids. Unfortunately, that is the case, and that kind of does also lead to the difficulty in diagnosis because there's such an overlap. Again, as an employer, to understand that it's quite difficult to be diagnosed because of all the overlaps. It's being really mindful that an individual's journey of a diagnosis will take time, just because of the way the tests and the diagnosis systems that are set up. So if you do have a staff member or an individual who is going through a diagnosis, be really mindful, be kind, being compassionate, because they are going through something in their life where they just want an answer, but it is taking a long time, where they know they have something that isn't right, their menstrual cycle isn't normal, and it is impacting their day-to-day life. So again, just being really open-minded and being mindful of their journey as well through the diagnosis. It's not just they've got the condition and that's that. There is a lot of pre-work to be done as well. In terms of a diagnosis of adenomyosis, you can have a pelvic exam. So during a pelvic exam, your provider may notice that your uterus has gotten larger, softer, or is painful to touch. You may be then offered an ultrasound, and this is a transvaginal ultrasound, which uses like a wave, sound waves to produce images of your pelvic organs. And these images can also show the thickening of your uterine wall. And then also you might have MRI scans, and these can show the uterine enlarged and the thickening of areas in your uterus as well. In terms of treating and managing adenomyosis, the treatments can ease pain and help the bleeding, the heavy menstrual bleeding. So in some of the ways we can combat this is through pain medication or hormonal medication. So when I mean pain medications, I mean anti-inflammatory drugs such as ibuprofen or naproxen, and hormonal medications such as the contraceptive pill, and any other hormonal medications around that as well. But this is a conversation that you should be having with your specialist nurse or your GP to better suit the treatment needs for what you need treating. And finally, you can have non-hormonal treatments as well, and that is stuff like tranexamic acid, which can reduce the amount of heavy menstrual bleeding. The final treatment with adenomyosis, and again, this is one that I would highlight you have a very in-depth conversation with, your loved ones, with your family, your partners, but also a very in-depth conversation with your doctor and your specialist nurse, because there is a treatment, there is a surgery that can remove, obviously, your uterus, a hysterectomy, which obviously will remove the adenomyosis because it's within and it's contained within the wall, the muscular wall of the uterus. But obviously this will mean you not having a menstrual cycle, and obviously meaning that you will not be able to get pregnant. So it is a treatment option, but it is a treatment option that you must have an in-depth conversation about with everyone kind of around you and people within your support system. So just wanted to highlight that. Up next, I want to talk a little bit about fibroids. So fibroids are the most common gynecological condition. It's closely followed by endometriosis in second place. Fibroids are non-cancerous growths and are found in or around the womb. The exact cause of fibroids is not fully understood, but we do know that there is a link to estrogen. Fibroids are more common from puberty up until menopause, as this is when estrogen levels are high. On the right-hand side, you can see 4 different types of fibroids. So on the top right, you have submucosal fibroids. Underneath that, you have an image showing pedunculated fibroids, just kind of going clockwise, anti-clockwise. You have subserosal fibroids, and then finally you have intramural fibroids. The symptoms of fibroids are or can be heavy periods, prolonged periods, so bleeding that lasts a long time, painful periods, swelling in your tummy, pain or pressure in your pelvis or lower back, pain with sex, constipation, needing to pee more often, and also difficulty getting pregnant. In terms of a diagnosis of fibroids, you would first go and speak to your GP. Your GP may suggest that you have some pelvic exams, and depending on your results, they may refer you to a gynecologist. A gynecologist will then run some further tests, and these may include a blood test to check if you have anemia. You will then also be offered an ultrasound, and you might have two ultrasounds. So you might have the one that looks at your womb and your ovaries through your tummy using a probe, and the other one would be a vaginal scan. You can also have a hysteroscopy. So this is a procedure that looks inside your womb using a narrow tube-like telescope with a camera. And during this, if they do find small fibroids, they can also remove them. And if you do have this treatment, they may also take a biopsy as well at the same time. And finally, again, you may be offered an MRI scan as well. In terms of treatment, there are several treatments to fibroids, but again, the treatment will depend on the individual and the individual's symptoms. Because we are trying to impact, obviously, your daily life. So you want the best for an individual so they can continue to live a good quality of life. And also there will be an impact in regards to if there's conversation around having children as well. So all these kind of factors will take into your treatment option. And there's two different types of treatment options. So you can have medicine, so painkillers, you can reduce heavy menstrual bleeding. You can also take medication that can shrink fibroids as well. But then also there is other treatments such as surgery. So you can remove the fibroids. You can have a transcervical resection, an endometrial ablation, and many more surgeries as well. But again, these are the conversations that you need to be having with your specialist nurse, and putting a lot of research into which kind of pathway you want to go to. And up next, I just want to touch base on heavy menstrual bleeding. Heavy periods, again, are normal and are common, and you may just be an individual that does experience heavy menstrual bleeding, but you may experience, in terms of the condition, you may have heavy periods if you need to change your pad or tampon every 1 to 2 hours, or empty your menstrual cup more than often than is recommended. You might need to use two types of period products together, such as a pad and a tampon. You may have periods that last more than 7 days. You may pass blood clots that are larger than 2.5 centimeters, and that's the size of a 10p coin. You might bleed through your clothes or your bedding. You may experience heavy menstrual bleeding where it's impacting, again, your day-to-day activities like exercise, or you're having to take time off work because of your period. And you may also feel tired or short of breath a lot. And in terms of the causes of heavy menstrual bleeding, as I mentioned, it is common, but there can be some causes such as conditions affecting your womb, your ovaries, or hormones. So all the conditions that I've just previously mentioned. You might be on some medication and treatment. We have obviously found that, individuals who might be going through treatments such as chemotherapy may experience heavy menstrual bleeding. Stress and depression can also cause heavy menstrual bleeding. So just, kind of just reassessing, life situations, etc., and just kind of reflecting on, your stresses. But also, very rarely is this the case. Heavy periods can also be a sign of womb cancer. So just make sure you're regularly going for checkups, etc. But that is quite rare. In terms of treatment, they don't always need to be treated, but there are treatments that can help if it is impacting your day-to-day life. And this will be treatments that you can access through your GP. So it can be types of contraception, such as a combined contraceptive pill, medicine to help reduce the bleeding. As I mentioned earlier, tranexamic acid can reduce heavy menstrual bleeding. You can also be given anti-inflammatory painkillers such as mefenamic acid or naproxen or ibuprofen. You should request a blood test as well, just to check your iron deficiency. And if these treatments do not work, do go back to your GP, and they will refer you to do more tests with a specialist. Just before I move on, because we are going to move on to a little bit more about, more workplace scenarios and situations. I know obviously it was kind of a whirlwind. And if you do want to obviously have questions, do pop them into the chat and I will get to them. I know it's quite, that first couple of slides were quite medically heavy in terms of explaining the condition, etc. And the reason why I want to explain the condition along with the symptoms and the treatment options is because if you are here today as an employer, is again being really mindful of all the different obstacles an individual has to go through to even get a diagnosis, but when they do have a diagnosis, to understand that treatment options are so different from each other for every individual. Some treatment options may not work for the individual, so they might have to continue trying different treatment options. So again, it's a whole whirlwind of finding out the condition and then kind of treating the condition and managing your life. So as employees, I can totally understand it will be so difficult through your journey trying to figure this out, but also manage your life, your personal life, work commitments, etc. But as employers, again, be really mindful, have a culture of openness and have a culture of where staff feel confident and comfortable coming to you to be able to ask questions or let you know what they're going through. So that's going to segue quite nicely into the next bit, which I'll talk a little bit about workplace, mental health in the workplace and supporting your colleagues. So one thing I ask employees to consider a few following things, and I also ask employers to consider a few things. So I'll start with the employees. So with the employees, share information. As I mentioned earlier, share what you're going through, share, how it's impacting you, share what your condition is, what it means, how it impacts you, how it affects you, and continue discussing treatment options. And kind of, if you are comfortable with an individual, with your manager, with your supervisor, kind of where you are in your treatment option, because again, that would be quite empowering for you both to understand, but be able to at least map how your employer can support you. And just continue explaining what you're experiencing and how it affects you. Like I mentioned, every condition will impact an individual differently. So if you continue to explain how it's impacting you, that will really go a long way. Seek advice and support. So you have, you might have your HR team, tap into the NHS website, which has great resources. Endometriosis UK, we have an area on our website that's called useful links. And we have a range of different resources on there, not just specifically on endometriosis, but other areas of work as well. And also create your own support network. And this could either be in work or outside of work as well. Be mindful of not assuming or expecting an employer to make reasonable adjustments automatically. It might take a while. So be open-minded about your working arrangements. But if they stop working, please do say so. Please let your employers know if you get to a point in your reasonable, you've made some reasonable adjustments, but they're no longer working for you. Do speak up, do let them know, just so you can work together and just create a better working environment for yourself, but overall organizationally as well. And try to understand the challenges also from your employer's perspective. And I would like to highlight this because there are job roles that are frontline, front and center, that can be quite difficult to step away from. If you're here today, perhaps you work in a hospital, you're a nurse, it is a lot harder to ask or seek reasonable adjustments because you're so frontline. So, be mindful of the challenges, but don't shy away from still having these open conversations with your employer, because I think if your employer even understands what you're going through and understands your condition, again, that goes a long way. They may be able to, or they may not be able to say, sorry, you can work from home today. In some cases, you can't do that because of your job's sake. But even for your employer or your manager to come to you and be like, I know you're struggling today, just let me know what I can pick up on. Or if you need some time away from your desk, or if you need some time off your feet, just let me know. I can rework the rota or I can step in. So having those conversations, I think, are really important, and to continue having them. And on the right-hand side, what I ask employers to consider is Continue learning. Knowledge is power. So if your staff is coming to you and sharing information, ensure that you're soaking that information in, that you're going off, you're doing kind of your own research. And I'm not saying you spend, hours and hours on it. Just tap into it or just read the NHS website. Just, do a bit of learning yourself, because knowledge will go a very long way. How can you think about how your organization implements best practice? Are there things already in place? If there are things already in place, do your staff know about them? I've spoken to many employers where they have great policies in place, great processes in place, but many of the staff just don't know about it. So just make sure that you're cascading that learning and that best practice among all your staff members, and everyone knows. And also start thinking about areas that you can improve. And when you start thinking about areas of improvement, think about the challenges that go hand in hand with that as well. So up next, I'm going to talk a little bit about best practice and actually suggest best practice examples. I've split this up into 3 different sections. So I have policies and support, I then have awareness, and I then have practical considerations as well. So we're going to start with policies and support. Are your policies and procedures supportive of those with menstrual health conditions? Have you checked your existing policies? Do they ensure those with menstrual health conditions or potentially cyclical symptoms are not disadvantaged? That's really important, that everyone feels that they are supported through their policies and procedures at work, and that's a really good starting point as employers to make staff members feel heard and feel seen. One other thing that I think is not much of a policy, but I guess it might come under your processes, is if a staff member is logging in a sick day, say they're experiencing a really bad flare up because they have endometriosis, and they cannot physically work on that, they physically cannot get to their screen or they can't get into work and they need a sick day. What options have you got on your drop down when they log in their sick day? Because I've spoken to many employers and they don't have an option, and it can be something as simple as menstrual health. You don't have to be very, explicit in regards to which condition it is. You can just have it as a top line: menstrual health, you're off sick because of a menstrual health condition. It's so empowering for an individual to be able to kind of tap into the drop down, see that there's an option for them, rather than putting it down as a migraine or diarrhea or vomiting, because that's not associated with what they're feeling and what they're signing in with, or signing their sick day with. Again, just being really inclusive, open-minded, and again, making people feel heard and listened to as well. Facilitate conversations about individual needs and see what the flexibility can be applied to help them thrive at work. I think I've mentioned earlier, having open conversations and continuing to have these conversations is key. Encourage staff members to feel they have a safe space, and colleagues who understand their experiences. Think about appropriate training for line managers who create the supportive working environment. Can they have effective training in menstrual health? But also think about, away from menstrual health, they need to be able to have confident conversations. So can there be training around just, boosting confidence conversations, training around that, or training around having difficult conversations with staff members, or maybe leadership training, etc. I think all this will really, really enhance managerial skills to be able to have conversations, but also enable staff members and enable line managers to allow staff members to feel really comfortable when they're having these conversations. Because as a staff member to come to a manager, it can be quite vulnerable to explain what the condition is. It's not the most easiest of conditions, if you have a mental health condition, to explain what you're feeling, what you're going through, if you're still trying to get a diagnosis, etc. It is quite draining to continue also speaking about it as well, and having to explain every so often how it's impacting you. But if a line manager makes you feel kind of comfortable, and just going back to the safe space, it will be a lot easier. So just make sure that there's effective training in place for managers as well. Chronic pain conditions also coincide with managing symptoms. So just be really mindful that a lot of these menstrual health conditions do come with chronic pain, come as a chronic pain condition. Health and wellbeing initiatives. What do you currently have in place for health and wellbeing at work? And again, Is it supporting those with menstrual health conditions? If not, that's a really great place to start looking into to allow staff members feel like they are supported. Occupational therapists and HR guidance, do you have that in place? If not, is that something you can? And if you do have that in place, do your staff know about it? Acknowledge that some staff might be suffering without being diagnosed. Again, be supportive, and just be kind and compassionate overall. Awareness, sorry, bear with me, I'm just going to move this out of the way. Awareness, so raising awareness around menstrual health at work to help staff feel supported. Do all managers know the difference in conditions and how they're impacting their staff? It can be incredibly supportive and empowering and such a real relief for an employee to say to their line manager or supervisor, I have PCOS, and for them to hear back, I know what that is. Let's have a conversation around how it impacts you and how we can support you. That whole scenario and situation within itself, again, it can be so supportive for an individual to step into a room and just feel from the offset that they're heard, they're understood, and that they're receiving the support that they need, or that they should have in a workplace. Make sure there's more menstrual health information within the organization. I know, loads of organizations have like e-portals or online kind of tools where they can post information, or perhaps just go for the old school kind of way, having leaflets around the office, the toilets, the bathrooms, etc. Just spreading that information more and more within the organization will really start to navigate these conversations that should be happening in the workplace. Think about menstrual health groups, so advocating for women's health. Could you start, a little group coming together? It could be once a month, just discussing, how they're feeling, things that, because a lot of learning will happen from each other as well. But it can be really good to have a group that advocates for women's health at work, and it can be very empowering, and you can learn a lot from it. Collaborate with menstrual health experts and organizations. So, lunch and learn talks, Endometriosis UK do lots of lunch and learns, and we can either do it online or we can come into you face to face. There are other organizations and experts out there that can also offer the same things. Just start to think about collaborating with them. And this can happen during like awareness months, for example. So endometriosis awareness month is in March. Could you possibly do something during March to highlight that? So take action in the workplace, take part in fundraising challenges, join employer schemes to show commitment to creating supportive workplaces. Foster a workplace culture that values and supports mental health as well. Discourage stigma surrounding mental health conditions and encourage open conversations. Now, the reason why I've highlighted mental health there is menstrual health and mental health do go hand in hand. If I highlight PMDD, it is a mood disorder. So first and foremost, understanding PMDD, but also understanding that an individual's mental well-being is also very important. Again, will work very well hand in hand, and having those conversations openly will be very advantageous of an employer, but also employee as well. Again, going back to taking time to learn about conditions, and don't use language such as, oh, they're PMSing again. That is not the language you should be using in a workplace. Even if it is a bit of a joke or banter, it's not nice for someone who has a condition and they're just being put down as they're PMSing again. It's a little bit more than just PMSing. It's not the correct language that you should be using in a workplace, nor should you kind of be associating with, something happening in the workplace if someone's not feeling great or not looking great, just putting it down to they're on their period. It's a little bit more than that, and just taking that time to learn about a condition can go a long way. Up next, practical adjustments. This might not be for all. It can be quite different for everyone in terms of the employer, your setting, where you're based. But just start thinking about someone with menstrual health conditions. And for example, if you're office based, do you have easy access to toilets, access to private spaces if an individual is experiencing pain? But if you're a workforce that requires to wear a uniform, consider having different sizes and different options. So, for example, if someone with endometriosis may experience bloating. As I mentioned earlier, PCOS, if someone has PCOS, they may fluctuate in weight. So do you offer multiple sizes to ensure staff feel comfortable? Also offer darker colours for those experiencing heavy menstrual bleeding. Just a few things just to highlight that if you have got a uniform in place, the difference, there are small changes, but it can impact an individual tremendously to feel more comfortable at work. Consider flexibility around working hours. This will benefit those with menstrual health conditions and enable them to thrive at work. And as I mentioned earlier about doctor's appointments, some appointments have to be taken. But first and foremost, doctor's appointments are very rare to come by. So if someone does come up or does get a doctor's appointment, do allow them to take them. And some appointments are synced with menstrual cycles, and some may even need to be conducted at certain times in the month and even within the day. So be as open-minded as you possibly can, and just be really compassionate to understand that unfortunately this is kind of what needs to happen. They need to attend that doctor's appointment, especially if they're trying to get a diagnosis. It's, I can't highlight more how important it is to allow them to be able to just get relief from the desk for half an hour, go to the doctor's appointment, do the tests that they need to be done, and just hop back on. And also reassigning work or duties. Again, I know not everyone can do this, but if you do know, or if you know of a staff member who might be flaring, or if some people can know when they're going to be experiencing a flare up or not be feeling very well. So just having open conversations with your supervisor or your manager, just to highlight that, I may not be able to get to X, Y, and Z. I can get to it next week. But for a manager to be like, do you know what? I can take that off you. I'll focus on that today. You can focus on this. So just a few changes in and reassigning work or duties can go, again, a very long way to support those with menstrual health conditions. So just wanted to show you a balance of scales. So at the top, you have an individual that might have repeated absences because there isn't, the support that they need, or the processes in place for them to be able to take time off work, or just take a sick day, or just step away from the screen without having to log it as a sick day. Might obviously trickle into poor staff retention. Performance levels might drop a little bit. They might start to feel isolated. But at the bottom, if you have an organization or if you have an employer who has a culture of openness, they are open to making adjustments and adaptations, you have supportive line managers in place, and you are, signposting your staff and, sharing resources, it can balance out. And it can balance out so great that the staff member feels exactly where they need to be. They're thriving at work. They feel supported, and they feel heard. But also from an organizational point of view, and in regards to business needs, it is balanced out, and it can work. It can work very well together if you have the bottom. If you have that bottom bit of the scale happening, it will definitely benefit your employer, your employee, and overall business needs as well. Just a few quotes that I'd like to share from some of the work that I've been doing with menstrual health at work. So the first one, we've started a women's health initiative at work. I can let you know that has been going really great for this organisation, and they are being listened to more, so that's fantastic. Suffering from endometriosis and not really knowing what I can and can't do, it's good to see I can ask for some flexibility. I feel empowered to speak to my manager about flexibility around my working hours and days. I have a woman in the team who has endometriosis, so it's helped me better understand the condition and how to best support her. Discussing menstrual health in the workplace with the same attitude that one would discuss a broken ankle has really helped to normalize words, spread awareness, and made me feel so supported as a result. I've had to ask for support from my employer in relation to fertility treatments, access to toilets, and flexibility regarding medical appointments. Again, I can highlight that for this employee, she has come away from this being very supported from her employers, just because she highlighted the support that she needs. And finally, they allow me to go back to my hometown and work from there, so I can be closer to my family when I'm not doing well with my mental health due to physical symptoms of adenomyosis and endometriosis. So people you need in your support team, and this might be in work or outside of work, but if you're here today as someone who is looking to support an individual who has a condition, these are the kind of things that I would like you to kind of take away from today as well. So someone who celebrates your wins, no matter how big or small, but also shows up during the hard times. Someone who takes things off your plate to make those hard days easier without being asked. Someone who makes you feel seen, validated, and normal. Someone who tries to learn and understand through asking and listening instead of making assumptions. Someone who asks how they can help and understand that individuals with menstrual health conditions have different experiences. Someone who checks in from time to time. People with menstrual health conditions often struggle maintaining their energy levels and attending social gatherings. So, checking in from time to time will again feel for the individual that they are very supported, and they're not kind of feeling isolated or left out. And finally, someone who does not judge you. Menstrual health conditions overall are complex, and it's challenging for individuals to predict when they experience a flare up or pain or energy fluctuations. So, again, don't judge, be mindful, be kind, and be compassionate. So I just want to highlight some of the resources that I spoke about earlier. So PCOS, you have Verity, who do great work with supporting individuals with polycystic ovary syndrome. You have the International Association for Premenstrual Dysphoric Disorder, PMDD. Again, tons of stuff that they're doing. Adenomyosis. Currently, there isn't a charity that focuses solely on adenomyosis, but there is an individual that we work very closely with, the Adeno Gang. Tanya does great work around supporting those with adenomyosis. I can also just highlight that, endometriosis will be looking into adenomyosis as well, a little bit more deeper. And we do have a few things already on our website, so you can also tap into that as well. Fibroids, NHS have a great kind of resources pool on the NHS website, as well as heavy menstrual bleeding. So do have a look on that as well. And again, I mentioned earlier around the other useful links on our website. So do have a look through that as well if you need support. And if you need further, guidance or support, or you'd just like to email a few other questions that might come up, do contact me. I know I sent an email to you all today, but you can also email employers at endometriosis-uk.org. You can also email them as well, and the correct staff will pick up the questions or the guidance that you may need.